So let me tell you what we're doing with case and contact investigation in the perspective that we just had of how sobering how much we're seeing. So given the increase in cases in the nation, CDC issued new guidelines for when there are substantial levels of COVID-19 in the community, and the state and local health departments have to prioritize contact tracing efforts. As I mentioned before, we did something similar in April and May when it got to that level. So the Virginia Department of Health recently announced, because of substantial levels of COVID-19 community transmission in the state, local health departments like Arlington may need to prioritize contact tracing efforts for key elements of the population. During this time of significantly high case volume, traditional methods of contact tracing would be less effective because we may not be able to complete it all. So that's why triaging is important. So this means essentially that we may not be contacting everyone with COVID-19 infection, which then means we wouldn't be getting to all close contacts to someone with infection until a time we see a reduction in these significantly high case volumes. So the CDC put out guidelines, and VDH is using them to prioritize follow-up of cases and tracing of those close contacts of those cases. If we are pushed, it would be people diagnosed with COVID-19 in the past 6 days and their household contacts. And that goes to Mr. Carantonis' point of that graph earlier. There may be a lag in when the lab was ordered and when we receive the lab back. So if, let's say 6 days have passed or more 10 days have passed, we're not going to do follow-up at that point because the juice would not be worth the squeeze to be able to change people's behaviors and have them stay home. Obviously, we'd be prioritizing people living or working in or visiting congregate living facilities. We would be prioritizing people involved in known clusters or outbreaks, and people at increased risk of severe illness or being in settings. So if they're a healthcare worker and we know that, we would be following up with those individuals. So just as a reminder, as cases of COVID-19 increase across the Commonwealth, this change will allow us to deploy resources where they will have the most impact. This is why we're urging residents to continue to follow the public health guidance on wearing masks, physical distancing, and to notify their circle of friends and family quickly if diagnosed with COVID-19. It's one of the ways to help with this effort to get the information out to people to say, look, we need you to stay home. As a reminder, it's still important to answer the phone if an Arlington contact tracer calls. All of these things will help us to reduce the burden here in Arlington.